If you are over 60, your body can start showing small warning signs before a nutrient problem becomes obvious. Many of these signs look harmless at first. A change in your nails, unusual oiliness of the skin, cracks at the corners of your mouth, or dry, flaky patches around the face. Some can be connected to nutrition, but the biggest mistake is assuming that one symptom always means one deficiency. In this video, I'm going to walk you through 23 signs to watch, and I want you to stay with me because several of the most important ones appear later in the list. A few should never be treated with a supplement alone. Before we begin, understand why deficiencies happen. One reason is poor absorption. If your digestive system is not absorbing nutrients properly, or if bile flow is reduced, fat-soluble vitamins such as vitamins A, D, E, and K can become harder to absorb. Another reason is poor diet quality, and a third is relying too heavily on refined, highly processed foods that provide plenty of calories but not enough vitamins, minerals, protein, or healthy fats. That is why I do not want you diagnosing yourself from a single clue. Your diet, medications, digestive health, and medical tests help complete the picture after 60. Sign number 1 is white spots on the nails. Many people immediately call this a zinc deficiency. Zinc is important for healthy skin. Minor trauma to the nail is a common cause. If you also have poor appetite, slow wound healing, hair loss, or other concerns, then zinc status deserves a closer look. Sign number 2 is unusually oily skin. Zinc plays a role in normal skin function, but oily skin is not a reliable zinc test. Hormones, genetics, skincare products, and conditions that increase androgen activity can all affect oil production. The right approach is to look at the whole pattern rather than immediately reaching for a zinc supplement. The pattern matters more than any isolated symptom. When several changes appear together, especially with poor appetite, weight loss, or digestive problems, your nutritional status deserves a much closer look. Sign number 3 is cracking at the corners of the mouth. This one has a stronger nutritional connection. Riboflavin, or vitamin B2, deficiency can cause painful cracks or lesions at the corners of the mouth, along with swollen or cracked lips. Other deficiencies and local irritation can contribute, so persistent cracking deserves attention. Sign number 4 is rough, flaky, or scaly skin. Essential fatty acid deficiency can affect the skin barrier and cause scaling or dermatitis. But dry skin is common after 60 and can also come from weather, hot showers, harsh soaps, eczema, or other skin conditions. And the next sign is where this list becomes more important, because a yellow change in the eyes should never be dismissed as simply another vitamin problem. Now we come to sign number 5, and this one is different from the first 4 because it should never be treated as a simple nutrient problem. Sign number 5 is yellowing of the whites of your eyes. This is called jaundice. The yellow color comes from a buildup of bilirubin, a substance produced when your body breaks down old red blood cells. Your liver normally processes bilirubin and sends it into bile so it can leave the body. If bilirubin builds up, the whites of your eyes can turn yellow. This can happen with liver disease, bile duct problems, gallstones, and certain blood disorders. So if you notice yellowing of your eyes or skin, especially with dark urine, pale stools, abdominal pain, fever, or unusual weakness, do not simply buy bile salts or vitamins and assume the problem is fixed. You should get the cause checked. Sign number 6 is a chronic cough. It is tempting to blame low calcium, but chronic cough is not a reliable sign of calcium deficiency. In adults, a cough lasting 8 weeks or longer is considered chronic, and common causes include upper airway problems, asthma, reflux, smoking-related lung disease, and certain medications. That distinction matters after 60. If you have been coughing for weeks, especially if the cough is worsening, producing blood, causing shortness of breath, or coming with unexplained weight loss, it deserves evaluation. Calcium is important for bones, muscles, and nerves, but taking calcium is not a substitute for finding out why a persistent cough is happening. Sign number 7 is swollen or bleeding gums. This has a much stronger nutrient connection. Severe vitamin C deficiency can cause swollen, bleeding gums because vitamin C is essential for collagen formation and normal tissue integrity. Your gums depend on strong connective tissue around the teeth and small blood vessels. But do not assume every bleeding gum means low vitamin C. Gum disease is common, and brushing technique, dental plaque, medications, and other conditions can contribute. The practical step is to make sure your diet includes vitamin C-rich foods such as citrus fruit, bell peppers, broccoli, strawberries, and tomatoes while keeping up with dental care. Before we continue, if you are still with me, write the number 1 in the comments. It tells me you are paying attention to these early warning signs. Sign number 8 is trouble seeing in dim light. This is one of the classic signs of vitamin A deficiency. Vitamin A is essential for the retina and for the visual process that helps your eyes adjust when light becomes scarce. If you struggle to see when entering a dark room or driving at night, do not automatically assume vitamin A is the answer. Cataracts, retinal disease, glaucoma, medications, and age-related changes can also affect night vision. Vitamin A deficiency is one possibility, not the only explanation. Sign number 9 is persistently cracked or chapped lips. Riboflavin or vitamin B2 deficiency can cause swollen and cracked lips, including cracking at the corners of the mouth. This connects directly with sign number 3. The important word here is persistent. Dry weather, dehydration, lip licking, sun exposure, irritating products, and medications can all dry the lips. If the problem continues despite basic care, then your diet and nutrient status deserve a closer look. This is especially important after 60, because medical conditions and medicines can produce similar outward signs even when your nutrient intake looks adequate. And now we move to sign number 10, because swelling around the ankles can look like a simple mineral imbalance, while sometimes pointing to something far more important. Sign number 10 is pitting edema around the ankles and feet. If you press a finger into the swollen area and a dent remains, that is pitting edema. The important correction is this. This swelling is not a reliable sign that you need more potassium. Low potassium can cause weakness, fatigue, constipation, muscle problems, and, when severe, dangerous changes in heart rhythm. But ankle swelling has many other causes, including vein problems, heart disease, kidney disease, liver disease, and certain medications. After 60, new or worsening swelling deserves attention. One-sided swelling with pain, warmth, or redness can signal a blood clot, while swelling in both legs with shortness of breath can point to fluid buildup involving the heart, kidneys, or other systems. Do not start high-dose potassium on your own, particularly if you have kidney problems or take medicines that affect potassium levels. Sign number 11 is a strong craving to chew ice. This unusual habit is called pagophagia, and this one has a well-established connection with iron deficiency. Some people chew ice repeatedly without realizing that the craving itself can be a clue. If this sounds familiar, do not rely on taking iron blindly. Iron deficiency after 60 deserves an explanation. Blood loss from the digestive tract, poor absorption, medications, or an inadequate diet can all contribute. A blood count and iron studies can help determine whether iron deficiency is present and why. The goal is not simply to replace iron. It is to identify why your stores became low, correct the cause, and then restore iron safely with the right treatment plan. Sign number 12 is chest pain or angina, and this is one of the most important corrections in the entire list. Angina is not a classic sign of vitamin E deficiency. Angina happens when the heart muscle is not receiving enough oxygen-rich blood. It can feel like pressure, squeezing, heaviness, burning, or discomfort in the chest, and can spread into the arm, shoulder, neck, jaw, back, or stomach. New chest pressure with shortness of breath, sweating, nausea, dizziness, or pain spreading into the upper body should never be treated with a vitamin supplement. Call 911. Do not wait to see whether vitamin E makes it better. If information like this helps you separate a real nutrient clue from a symptom that needs medical attention, subscribe to the channel. That distinction matters after 60. Sign number 13 is recurring leg or calf cramps. Magnesium deficiency can cause muscle contractions and cramps, so it belongs on the list of possible explanations, but it is not the only one. Dehydration, prolonged activity, medications, nerve problems, circulation problems, and other electrolyte disturbances can also contribute. Before reaching for a supplement dose, look at your diet. Leafy greens, beans, nuts, seeds, and whole grains provide magnesium, along with other nutrients. Persistent, severe, or one-sided cramps, especially with swelling, warmth, or redness, should not be dismissed as a magnesium problem. Sign number 14 is irritability, nervousness, or a mind that will not settle down. Vitamin B1, or thiamine, is essential for energy metabolism and normal nervous system function, but irritability or excessive thinking alone does not diagnose thiamine deficiency. Poor sleep, stress, anxiety, medications, thyroid problems, and other factors can produce the same experience. Thiamine deficiency becomes more concerning when there are risk factors such as prolonged poor nutrition, malabsorption, or heavy alcohol use. Nutritional yeast can contain B vitamins, but it is not a guaranteed treatment for racing thoughts or sleep problems. And the next sign moves us from mood to breathing, where another popular vitamin claim needs to be handled carefully. Sign number 15 is asthma, and this is where vitamin D is often given more credit than the evidence supports. Vitamin D is important for immune function and bone health, and people with asthma can have low vitamin D levels. But low vitamin D is not the simple cause of asthma, and vitamin D supplements are not a replacement for inhalers or an asthma treatment plan. In fact, a major NIH-supported trial in adults with persistent asthma and vitamin D insufficiency found that adding vitamin D3 did not reduce the rate of treatment failure or asthma exacerbations. So if you have wheezing, chest tightness, coughing, or shortness of breath, the right move is to control the asthma itself and correct vitamin D deficiency only when it is actually present. Sign number 16 is thinning of the outer eyebrows. Some people immediately connect this with iodine deficiency because iodine is required to make thyroid hormones. That connection is possible, but the eyebrow change alone does not prove you need iodine. Thyroid problems can cause dry, thinning hair, and iodine deficiency can reduce thyroid hormone production. But thyroid dysfunction has many other causes. If eyebrow thinning comes with fatigue, constipation, feeling unusually cold, weight changes, or dry skin, the better next step is to have your thyroid evaluated rather than taking kelp or high-dose iodine on your own. Sign number 17 is tightness or discomfort around the right shoulder or upper back. You may hear this blamed almost automatically on the gallbladder, but that is too strong. Gallbladder attacks typically cause pain in the upper right abdomen. Digestive pain can sometimes be felt elsewhere, but isolated shoulder tightness has many causes, including muscles, posture, arthritis, neck problems, and overuse. If right-sided upper abdominal pain becomes severe, lasts for hours, or occurs with nausea, vomiting, fever, chills, or yellowing of the skin or eyes, that is different from ordinary muscle tightness and should be checked promptly. Do not use shoulder tension alone as a reason to start taking bile salts. Sign number 18 is frequent nightmares. Thiamine, or vitamin B1, is essential for normal nerve function and energy metabolism, but nightmares are not a reliable sign of thiamine deficiency. Significant deficiency is better known for neurological and cardiovascular problems, and severe cases can become dangerous. Sleep disruption, stress, anxiety, medications, alcohol, sleep disorders, and other factors can contribute to disturbing dreams. Nutritional yeast can provide thiamine depending on the product, but it should not be presented as a guaranteed way to stop nightmares. If these corrections are helping you look at nutrient signs more clearly, write nutrients in the comments. That tells me you want more practical videos that separate useful nutrition clues from misleading shortcuts. Sign number 19 is a craving for salty foods, especially late in the day. Salt craving can occur when the body is losing sodium or in certain medical conditions, including adrenal insufficiency, but craving chips at night does not automatically mean you are sodium deficient. Sweating heavily, vomiting, diarrhea, certain medications, kidney disease, heart failure, and hormone disorders can all affect sodium and fluid balance. After 60, simply adding more sea salt to food or water is not always the right answer, especially if you have high blood pressure, swelling, heart failure, or kidney disease. The better approach is to look at the whole pattern: your diet, medications, blood pressure, fluid balance, and symptoms before deciding that you need supplements. And the next sign brings us to another common mistake, assuming that persistent lower back pain can be fixed simply by taking a very large dose of vitamin D. Sign number 20 is persistent lower back pain. Vitamin D deficiency can affect bone and muscle health. But lower back pain is common after 60 and has many causes, including arthritis, muscle strain, spinal degeneration, nerve compression, osteoporosis, and kidney problems. So back pain alone does not prove that you need vitamin D. This is also where dose matters. Taking 10,000 IU of vitamin D every day should not be treated as a routine solution for back pain. For adults, the tolerable upper intake level is 4,000 IU per day. Higher doses should be used only under medical supervision to safely treat documented deficiency. More is not automatically better. Excess vitamin D can raise calcium levels and create serious problems. If back pain is persistent, worsening, or follows a fall, it deserves attention. And if it comes with new leg weakness, numbness, or loss of bladder or bowel control, seek urgent medical care. Those are not signs to manage with a supplement at home. Sign number 21 is a persistent urge to eat, or repeatedly eating dirt, clay, or other non-food substances. This pattern can be pica, and iron deficiency is one nutritional problem connected to it. Zinc deficiency can also be involved in some cases. But eating dirt is not a safe way to replace minerals. It can expose you to parasites, toxins, or substances your body should not be consuming. If you develop persistent cravings for dirt, clay, ice, starch, or other non-food items, the right next step is to look for the cause. A blood count and iron studies can help determine whether iron deficiency or anemia is present. Sign number 22 is erectile dysfunction. Zinc is important for normal reproductive function, and severe zinc deficiency can affect many body systems. But erectile dysfunction is not simply a sign that you need more zinc. After 60, ED can be connected to blood vessel disease, diabetes, nerve damage, hormone problems, medications, smoking, obesity, stress, or other health conditions. In fact, because erections depend heavily on healthy blood flow, persistent ED can sometimes be an important clue about cardiovascular or metabolic health. Do not hide the symptom behind a supplement. Find out what is driving it. Sign number 23 is depression. Vitamin D and mood have been studied extensively, and low vitamin D levels are sometimes found in people with depression. But that association does not mean depression is simply a vitamin D deficiency, and vitamin D should never be described as a natural antidepressant without side effects. A large randomized trial in adults over 50 did not show that vitamin D supplementation prevents depression. If your vitamin D level is low, correcting it is good for your overall health. But persistent sadness, loss of interest, hopelessness, sleep changes, or difficulty functioning deserves proper evaluation rather than being treated with a single supplement. Now step back and look at the bigger lesson from all 23 signs. Nutrient deficiencies are real, and your body can give you clues. But the same outward symptom can come from several different causes. The right approach is not to chase one symptom with one pill. Look at your diet, medications, digestion, medical conditions, and, when appropriate, the right tests. Start with nutrient-dense foods, correct confirmed deficiencies, and pay attention to warning signs that deserve medical care. You do not need an extreme supplement routine. You need the right nutrient in the right amount for the right reason. If this video helped you understand your body more clearly, give this video a like and share it with someone over 60 who could benefit from knowing these warning signs.